bonus material. Aren't you just the luckiest? So we've talked about vents. Now let's talk high frequency oscillatory ventilation. So this is a ventilator, but it's a very special ventilator. This is lung protectives for protecting lung compliance in very high risk patients. Used a lot in pediatric and infant neonatal patients, but you do see it used in adult patients just for lung productivity. The air coming in is heated, it is humidified, and this high frequency, this oscillating vent, this oscillator provides constant airway pressure, usually somewhere around 30 centimeters of water. So if our normal kind of peak pressures or normal airway pressures are somewhere between or somewhere around 20 or so, this is providing a little extra support for that. So it's a constant pressure, providing constant airway pressure for our patients. So we've got that constant airway pressure. Imagine your airway being open, kind of like inhalation all the time, and it's done through this oscillating pump. So if you think of this oscillating pump kind of like a pulsating speaker, and that speaker is pulsating around 300 times per minute. It's not really a respiratory rate, but we'll call it a respiratory rate. So patients is kind of sort of breathing 300 times a minute. They're not really breathing 300 times a minute, but that's how often it is oscillating. So here's an oscillator for you. Let's see if we can get this to go. And see how often those lungs are inflating, deflating, inflating, deflating. So that's your oscillator. So we're going about 300 times per minute, give or take, and just keeping a constant airway pressure. So that was your oscillating vent, your high frequency oscillator ventilator. Let's talk about just very quickly high flow nasal cannulas. And these are exactly what it sounds like. It's a nasal cannula, except it is super high flow. High flow nasal cannulas typically used in pediatric patients and infants, but they are making their way into the adult world. So these high flow nasal cannulas, we're not stopping just at 4 or 6 liters per minute. We're going up 10, 15, 20, 25 liters per minute and really forcing some air in there. Because of that, they need to be heated. The air needs to be heated, air needs to be humidified, needs to be hooked up to a humidifier, because we don't want to be drying out those nasal passages. And what this does is we found that high flow nasal cannulas decrease upper airway resistance. So it can definitely help patients with some airway resistance issues. Think asthma, think COPD, right? So airway resistance issues can definitely be helped with high flow nasal cannulas. And there is a debate whether or not this is PEEP, whether it's not PEEP. It kind of depends on who you talk to. So the general consensus surrounding this is it's kind of like PEEP, but it's not really PEEP. But high flow nasal cannulas can do a lot of good with patients with upper airway resistance issues. There are some benefits to high flow nasal cannula use. It does still maintain ciliary function within our respiratory system. It decreases risk of inflammation, even though we're giving a good amount of oxygen. Decreases risk of inflammation. Does increase our functional reserve volume, functional residual volume in our lungs. But like PEEP, as we increase it, it does increase intrathoracic pressure. So should you be doing high flow nasal cannula on your own in the back of the truck? That's a solid no. Just don't stick them on nasal cannula and crank your your oxygen. Does need a special device. Does need to be heated. Does need to be humidified. So just a little extra info there for you. If you have any questions, comments, concerns, or cuss words, please let me know.